I did the beginning of a Kahoot in my earlier class I covered for Professor Morris this today. I'm going to continue with it. Now, you can't play it, as in you can't sign it up, but you can do your questions. You can do answers and see if you're correct or not. So I'll be sending you both portions of this, where you get the beginning where the students in the earlier class were able to answer it, but you will get the rest of it with me in my explanations. And I think that's going to work the best for you. All right, let me get it pulled up so I can see it. There it is. So we're on question 50 right here. This is where I ended it off. And this question was about a child with hemophilia, has fallen, needs swollen, painful. Treatment would include what? Now, because you're not going to be answering this as in clicking one of the buttons, if you want to, you can answer the questions out loud if you'd like, okay? So let's continue. Goes to 100, and this is the new review I put out this semester. I went and found information from your gap analysis, from your HESI, finding out those areas where the weaknesses were and making sure I covered it, okay? Discharge teaching for a child with cystic fibrosis about respiratory secretion should include what? Now, we know cystic fibrosis has two components. It's all about the lungs full of mucus. It's also about the inability to absorb nutrients. You don't have the enzymes, right? So it's the small intestines and the lungs. The respiratory, what do we need to do about it? Well, you need to take care of those secretions, loosen them up, because if not, they get thick, and they're like a petri dish full of growing bacteria. So percussion and postural drainage, absolutely imperative in cystic fibrosis. Your child with leukemia has had recent lab results with platelet count of 10,000. Nursing action. What does it mean in any patient with platelet counts of 10,000? You're at risk for bleeding, aren't you? Isn't that part of the bleeding coagulopathy cascade? It is. So place him on bleeding precautions, which would be what? Well, you're going to monitor for bleeding in the urine, in the stool, in the gums, bruising, and of course, soft toothbrushes too, right? And of course, no IM injections unless switch everything to IV if at all possible. And it doesn't matter whether the kid is a hemophiliac or ALL or anything. Low platelets, treat them with bleeding precautions. So a child starts a nosebleed for no reason. What do? How do you treat a nosebleed?
Is that when you pinch it, have them lean forward and pinch it for about 10 minutes?
And then if you don't get a response and it still bleeds, you need to get treatment. You have to get a treatment. And what they do, they put like nasal tampons in there. Literally, they're called nasal tampons, goes in there, blows up, creates pressure. And then we're going to look, why are you bleeding? Is it ITP that we don't know about? Is there some bleeding problem? Especially if it's more than one time, it's happening again. An 8-year-old semi-conscious boy is brought to the ER, elevated blood sugar, potassium, low pH, priority action. What do we need to do? What is this? What are these signs and symptoms telling you?
DKA.
DKA, right. Elevated blood sugar in acidosis. So priority, saline bolus, and regular insulin IV. And we'll be regulating that regular insulin IV drip according to blood sugars. Usually they say every 5 minutes initially, and then every 15 minutes, blood sugar, blood sugar, blood sugar, because we don't want it to get too low.
It's titrated, correct?
Absolutely, titrating it according to blood sugars. A child is admitted with hypoparathyroidism. What findings would you see that needs to be reported to the healthcare provider? Well, what does the parathyroid gland do? What does it regulate?
Calcium.
And if you don't have calcium, hypo, what do you have?
Muscle weakness.
Exactly. Because remember, calcium, magnesium, always think muscles. Those are two vital electrolytes needed for muscle contraction, whether it's tetany too much or weakness not enough. And you'll see that X either magnesium, calcium, especially in your med surge. A 2.5-year-old child had a epispadias yesterday, and they want to play. How can they play that's safe? Remember epispadias, they fillet the penis open and they create the hole on the end and put a catheter in and use the foreskin for closure.
Put together a large puzzle.
Oh, absolutely. You don't want anything to go and damage the penis, okay? Because I'm literally, if you look at the PowerPoint study guide I gave you, there's a filleted penis there. You can see how intense this repair is. It's quite incredible. I mean, the penis is flayed open. A child has Kussmaul respiration due to DKA. The increased respiration is trying to compensate for what? Now, I will tell you there's at least 4 acid-base questions on your HESI. At least in the past, it has been. So understanding what is you see, and then how do you compensate? Well, when you are in DKA, you're in metabolic acidosis. Kussmaul is respiratory alkalosis. You're trying to blow it off. It's trying to compensate. So these are things you need to look at prior to your HESI, acid-based problems. When talking with an adolescent regarding personal health concerns, what is most important? I remember at last HESI, I believe there was 3 questions about adolescents and approaching them and how to talk to them and about sexual activity, etc. So they are picking on adolescents lately.
Express their feelings open and honest.
Right. Now, they're going to tell you things that's going to blow your mind. Try not to look so shocked, because I've heard some things and I'm like, okay, and you're 16 years old. All right. So be there, be the support, and only information that you're going to get, we want to talk to them. And if we have some written information, always important to give those adolescents. In school age, conflict versus inferiority. What does industry mean? Now, HESI likes to take this question and say, if you have a kid in a hospital a long period of time who's under school age, you need to challenge them, but you need to challenge them in something that they can master, that they can do. You don't want to make it so they feel inferior. So industry is something that they can do. Inferiority, they can't. They're good at sports, they're terrible at schoolwork. They're great at schoolwork. I mean, it's either or, it could be. Or they're good at cooking, good at peeing the piano, so who knows? A child with a rash, fever, joint inflammation has rheumatic fever. Teaching should include what? Like, what is rheumatic fever? It's like acute glomerulonephritis, right?
Strep.
It is a strep infection. And remember that anti-streptolysin titer or ASO titer could be one of those labs that you would see that could prove that. And remember, we could cure everything in rheumatic fever except the heart valve. Once it's damaged, it's damaged. Contraindication to administering varicella vaccine to an adolescent. Remember, the varicella vaccine is a live vaccine. What do you know about giving live vaccines? You can't give to immunosuppressed people, patients, or corticosteroids renders you immunosuppressed. This is a question that I've seen both in pediatrics and in med-surg. Early detection of a hearing impairment is critical. Which one is of primary importance?
Speech development.
Sometimes this child's not speaking correctly and you refer them for hearing to make sure it's not a hearing issue. Because if you can't hear what you're saying, you can't pronunciate. Very good. In helping a child to adapt to a hospitalization experience, the best approach is what? It doesn't matter what age kid. I mean, adolescents, maybe not, but through school age.
Establish a daily routine and schedule.
Right. We want to have nap time, bedtime, bath time, and even the same sort of foods if we can. And that will help this be a less traumatic experience for children. They don't want to be there. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance?
20.
And that's a health assessment question. Now, what if they can't see there? And it's like they have to get up to 10 feet to be able to see. That's something that you would report to the healthcare provider to do some more intensive investigation with it. Is it just vision or something else going on? Referrals for cognitive impairment should occur when?
As soon as possible.
Right. And we do that. Number one, we're going to find out why there's cognitive impairment. Remember, things like hypothyroidism can cause cognitive impairment, especially in the infant. So we'll investigate that, but we want to get speech, physical, occupational therapy as soon as we can, because children are resilient. They do come back pretty quickly. That's why I love working with kids. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? I mean, we know approaching any young child, you want to first get on their developmental level and then let them play with everything. Let them play with you, with taking your blood pressure, and they're going to think it's fun. They're going to think it's a game. And then you get what you need quickly. What acid-base imbalance may you see with a child that's having diarrhea?
Metabolic acidosis.
Right, because diarrhea, you're losing alkaline because that's all your enzymes for digestion. Now, what if I said profuse vomiting? What would you have? What acid base?
Metabolic alkalosis.
Because you're getting rid of acid. Yes, excellent. Very good. You guys are thinking. I love it. A parent calls because her child was exposed to a child that has chickenpox. When is she contagious? One of the last chapters in the book, there's a couple questions I pulled out. And this is one of them.
Is it as soon as the rash appears until, oh, okay, I'm wrong.
It's 2 days before. That's why it spreads, because you don't know. Then all of a sudden they break out with this rash and you're like, oh my God, where was I the last 2 days? And then you get these pustules and they're oozy and juicy. Once they get crusted and are dry, then it stops being contagious. It could be 2 weeks before you're not contagious with chickenpox. What is the nursing priority preoperatively intervention for a child with a Wilms tumor? What do you know about a Wilms tumor? What have I really emphasized?
Not to palpitate the abdomen.
Right. And this includes, like, this is one of those cancers. We are not going to do a biopsy preoperatively because that's just going to open it up to the peritoneum and spread it. So again, don't touch it. And we're not going to do biopsies. We know it's there. We know what it is. A multi-select. If an infant has not passed the Meconian stool in the first 24, 36 hours, what would you assess for? I've already mentioned hypothyroidism.
Hirschberger's, hypothyroidism, and cystic fibrosis.
Absolutely. These are the 3 things that we would look at. Sometimes we have no clue. And these are the things you will see the newborn checked for because it's not normal for a kid not to stool. I mean, they have repeated stools in the first day. If they're not, there's a problem. A child with sickle cell disease most likely exhibit what signs and symptoms of a crisis? Sickle cell disease.
Dehydration. We're having pain, but we're treating for dehydration.
They're having pain, but yes, we're treating for dehydration because the pain is caused from all those cells buckling up. We hydrate them, we'll dilate those vessels, get those cells go, and that will take care of the pain. But it's the pain that shows them first that they're having a sickle cell. Very good explanation, whoever that was. When teaching the child and family about celiac disease, which of these food items is allowed?
Rice.
Rice. I had one student do her pediatric assessment on celiac disease, and on her teaching was a picture of a child and painted in big brows. Barley, rye, it's like all of the things you can't have were there on the brows. So it's barley, you could have rice, rye, and wheat are things.
And oats.
Oh,
Wheat.
thank you. I know it was brow. It's getting late for me tonight. Thanks. A child stepped on an old nail while playing outside. What action should the nurse do first? Number 1, I'm going to ask, when was their last tetanus shot? But what action am I going to do?
Cleanse the foot with soap and water. Apply an
Absolutely. Absolutely. We're going to clean it first. We want to keep it clean to prevent anything more from going in there. And then, of course, they'll get their tetanus booster after that. Good. Very good. A 6-year-old goes to the ER complaining of abdominal pain, fever, vomiting for the last day. What assessment is priority? Like, what do you need to know here?
Description of the abdominal pain.
Right. Is it right lower quadrant? Is it an emergency? Is it something we need to take care of quickly? Or is it just a gastroenteritis, right? There's a difference in treatment here. A 5-year-old fell from the monkey bars, crying, pain in her arm. What do you need to do first? You get this kid in. What's your first action you do?
I would check capillary refill.
Absolutely. You want to make sure blood's there. That's your number 1. Then you're going to put the cold pack and elevated and rice and all that and check pain level. But we want to make sure, number 1, neurovascular signs are intact. Excellent. What is one way to help detect hypo or hyperthyroidism in children? Or is it hypo or hyperpituitarism? It doesn't matter. Any hormone secreted to children, all of them affect the growth. Your thyroid and your pituitary. So height and weight, that's why we do it all the time. We can see, is there a decreasing? And then we need to ask. Now, if it's a hyperpituitarism or hypo, that means all of a sudden they stop growing. I'm going to ask the parents, wait, how tall is your family? Are they taller or you have a smaller family? Because it could just mean that it's the family short, right? So that's one thing that you need to ask in that case. What would be the most important to report to a healthcare provider on an 8-year-old status post appendectomy with NG tube to suction? Now, there's a lot of distractors there. What right here, I'm going to report. I don't care what type of child.
How about neutrophil count for 400?
There you go. This question had distractors up the yin yang, didn't it? But our concern here is that neutrophil count. This child, okay, yeah, status post appendectomy, and we know it's peritonitis, already has an infection. Neutrophil count of nothing means this kid could go into septic shock very, very quickly. But remember, any normal kid without all of that, neutrophil counts that low, that's your #1 priority child right there. A multi-select. Signs and symptoms of hypertrophic pyloric stenosis.
Allocytic mass, projectile vomiting, and poor appetite.
Oh no, they're hungry.
Or are they hungry? Okay, they just.
Oh man, they are so hungry because they keep vomiting. And the key is when you're looking at this 3-week-old to 3-month-old child, because that's the ages of pyloric stenosis, not older, those younger children. When you say they're vomiting, tell me, does it dribble out or does it go across the room like The Exorcist? If it's across the room projectiling, we know it's pyloric stenosis. What do we have to do? Make them NPO, get the ultrasound done, get the diagnosis, and start an IV, get them to the OR. But they're hungry. They haven't eaten. It just keeps coming out. Another multi-select. A child with chronic kidney disease has renal osteodystrophy. What outcomes would you see because of that?
Slow growth and bone pain.
Absolutely. And what else goes along with it? What has to do with bone and muscles and all that?
Low levels of vitamin D.
Vitamin D also. Think vitamin D, think of bones also. But yes, very good. You might see even malformed bone, disfigured. They're not going to grow as the way they should either. You suspect an infant has cryptorchidism. How are you going to examine this infant?
In a warm room.
Also, if you go to the doctors and they're checking and all of a sudden one isn't there, I would ask, have we ever felt that testicle before? Very important question, along with the warm room, okay? Good. A multi-select. What teaching would you give parents on how a hypospadias is corrected? We have hypospadias. We have epispadias. It means it's not coming out the end of the penis where it should. And the teaching on this is really, really important on some religions, the Jewish religion, because they want to do a breast, they want to do a circumcision. They can't. We need that foreskin for that closure because they splay the penis open, make the hole and that tube there, put that little stent there to hold it open. What do we do with that stent? We put it inside the diaper, leave it alone, do nothing with it. We just want to make sure we're measuring the urine. That's it. And usually they take it out 7 to 10 days later. A multi-select. A child with nephrotic syndrome will often given albumin and Lasix for fluid overload. What outcomes would you see if you're giving that? Remember, nephrotic syndrome is not renal failure. The kidneys don't like protein. It just gets rid of them. which means there's no protein in the blood or the body. So all the fluid goes interstitial and you puff up and you get edematous, like around the eyes, you see it. Albumin replaces the protein. Okay, so now you give the Lasix, you pull the fluid out because the protein's back in your intravascular. You give Lasix and woof, it diureses. So you're going to see that edema is going to go away. You're going to see the urine output increase. And because of all that extra, fluid, you're going to see the blood pressure decrease also. That's a huge concept. What lab value on one of your clients makes them a priority to see first? You know this. They're all interesting lab values, but what's priority?
Potassium.
No. Neutrophil count. Potassium of 3, yes, it's low, but it's not like 2. Okay, yeah, cardiac dysrhythmias, yes, I get that. But you have a child who's at risk for septic shock. That's what a neutrophil count of 400 or 500 is. But that was a good try. That would have been a second guess for me. Multi-select. An adolescent BMI of 90% complaining of urination. What test could you anticipate the healthcare provider in doing? Let's look at BMI of 90%. Isn't that like really high? This is a big child.
HbA1c and definitely a urinalysis.
Yes, we look at the obvious. It could be a urinary tract infection. They just happen to be big, but absolutely, we're going to be checking the hemoglobin A1C. And because they're urinating so much, they could be losing potassium. Okay. So that's why all 3. Again, let's make you think some more. What teaching should be done for an adolescent with Hodgkin's lymphoma getting chemo and radiation received? This is one of the diagnoses that they specifically pull out for this, along with cystic fibrosis.
I don't know why I keep wanting to say it causes hoarseness. I don't know.
No, not like me. It's infertility. So Hodgkin's lymphoma, the chemo and radiation, because sometimes of where these tumors are, remember, it's all upper, and the radiation is a lot, and it's a risk for infertility. And remember, cystic fibrosis also, they need a lung transplant, especially males, so they're able to have children, because there's a problem with their vas deferens and production of sperm. So after a bilateral lung transplant, after a year, they have more probability of being able to have their wife have a child. A child falls in a thick bush. He's covered in prickers and he's complaining of eye pain. What do you do? So now we're worried about something with the eye.
I would patch both eyes and send to the ophthalmologist.
Absolutely. And they call it a Fox shield. These are hard patches, not those soft ones, but hard ones. We're not smushing anything in there because it could be something inside the eye. I mean, if we see something floating, you could take a tissue, get it out. But you got prickers here. These are hard. Both, patch them both, because you don't want one eye working and making the other eye move. Patch them both, get them to the pediatric ophthalmologist or to a pediatric emergency room would work too. A 2-year-old goes to the ER, inconsolable crying and painful abdomen. What finding shows you this is a medical emergency? There's one condition in toddlers where their abdomens is a sudden terrible pain in their abdomen, and you cannot console these children. And it is called intussusception. What is the sign of intussusception that you would see? It's a current jelly stool. Open up their diaper, open up their underwear, and it'd be like almost like jelly, clear jelly with streaks of blood in it. And that's what you would see. That's when their intestines pull up. And until it comes out, they are going to be crying. And they're really, you can't console them no matter what you do until you fix it. When assessing a 2-month-old with vomiting, what questions do you ask the parent?
The forcefulness of the vomiting?
Absolutely. Is it one of those just drooling, which is reflux, or is it across the room and your treatment changes for whichever one it is? Good. You notice a 2-year-old with congenital heart disease, the heart rate is decreasing. What other information is important to report for the healthcare provider? Let's say you have a tetralogy of Fallot, and all of a sudden the heart rate is coming way down. What else are you going to look at?
BP and urine output?
Well, that urine output is actually good. It's probably going to decrease later. But a 2-year-old with that blood pressure, that's a newborn's blood pressure. So absolutely, blood pressure is what's going to be concerned. Sats to 95, above 92 is fine. The respiratory rate is actually pretty good. And the urinary output, as I said, that's actually adequate for this age child. What priority procedure will you anticipate for a child suspected of having Kawasaki disease? Kawasaki, it's that systemic vascularitis or inflammation of vessels. And we're always concerned about those aneurysms of the coronary arteries. So it's an echocardiogram. We want to see, are those coronary arteries okay? How do we treat it? IVIG, baby aspirin. Why do we use baby aspirin? It prevents clots. It thins the blood. It's like putting them on an anticoagulant. This is the only time we put children on aspirin. I'll multi-select. Why do we give aspirin to a child diagnosed with Kawasaki disease?
Prevent clots.
And decrease vascular inflammation too, right? Excellent, good. I'll multi-select. What lab test should be monitored for a child with congenital hypothyroidism?
TSH and T4.
What's another one?
I would go GH.
T3, growth hormone, no. Luteinizing hormones about pregnancy. T3, T4, TSH. And then there's this little trick. And sometimes you hear these questions. Why is it TSH high? It's because the T4 is low. Why is it T4 low? The TSH is high. Always remember they're converse. It's one high, the other low. Okay? I've seen a question like that in a couple HESIs ago. I'll multi-select. When entering the room of a child, the child becomes stiff, the arms and legs are shaking. What's your priority actions? What do you need to do?
Turn the child on their side.
Yeah,
You're going to monitor the time and duration.
and what if the seizure continues and continues and continues?
I would notify the response team.
There you are. It's all three of them. Never take a parent out of a room. They need to be there. Give them something to do. Have them here, just hold them on their side. It's okay. You know, everything looks all right. That's better than throw them out of the room. Parents always want to be next to their children. A 3-year-old boy with a waddling gait and falling is admitting for testing. What procedures would you anticipate? Remember Duchenne muscular dystrophy, ages 3 to 7 boys. It's the waddling gait, lordosis, falling down. How do we make that diagnosis? What examination?
An EMG.
Yes, and remember it hurts. You're spasming muscles like crazy, looking to see if they work. It hurts. A mother calls the clinic about her child. She's playing in the woods and she has a rash that is spreading. She asks, what over the counter is good to give this child? She calls you on the phone.
I'd say antihistamine would be good for the itching. And then,
Corticosteroid.
yes, yeah, oh no, okay.
You are on the phone. She's telling you this. This could be anaphylaxis. Get them the medical treatment now. Yes, those things are okay if you're there looking at it and they were in your doctor's office or in urgent care. It does work, but we don't know if that was an anaphylaxis. That was a trick question. A mother calls the clinic. A friend of her child has ticks from playing in a field. What do you tell the mother to do? Her friend has ticks. What do I do for my kid?
I guess remove them.
You're going to check the body. You're going to do a visual check. And if you can't remove them, they need to go to the physician and he needs to, or ER, wherever's the closest. What shouldn't you do for a child diagnosed with impetigo? Impetigo is an extremely contagious staph infection of the skin. My grandson had it. My daughter thought that he scratched something too much and it was spreading. I looked at it and said, that's impetigo. You apply a topical antibiotic, that Muciprint for staph, and you give them oral antibiotics, usually cefotaxime or Keflex is the other name for it. Never ever open up the wounds and the juice to be released because it spreads it, and it does spread. It will get more and more and more. That's how you treat impetigo. An adolescent goes to the school nurse complaining they're ringing in the ears. What examination should you do first? Take the earbuds out of your ears, girl, right? No.
Look in their ears.
Absolutely. Look in the auto. Look, see what's going on in there. You know, maybe I've seen actually bugs. I've seen beetles. I've seen ants. I've seen all sorts of crazy things in their ears, which could be that buzzing, what they could hear. How do we treat that? Actually, it was in the ER when I first saw it. They put mineral oil in it and it floats out and suffocates the bug, and then you could just pull it out. Yes, it's not fun. And usually they're scratching at their ear. A multi-select. An infant's being discharged after 14 days of vancomycin. What teaching should be included? Well, remember what's vancomycin. It's an aminoglycoside. It's extremely nephro and ototoxic. You do peaks and troughs, right? Now they're going home. What are you going to continue to monitor here?
Their auditory response.
Absolutely. Because, you know, probably they're not kidney. It's going to be, let's look for their lungs. And then, of course, yes, continue to make sure they're still with those urine output still going. Because nephrotoxic, ototoxic. Very good. And our last one tonight, a multi-select. When checking the lab values of a child with hypothyroidism, what lab values would you look at? Let's try it again.
TSH, T4.
Very good. Good job. So, guys, please do your attendance attestations. Make sure you get those done. I will be doing that review on Sunday. I will send it to you. So I wish you all the best. You have been a pleasure to teach. If I can do anything for you, just please send me a message and I will help you, okay?
Thank you so much. Appreciate it.
It's been my pleasure. Thank you, everybody.
Ours as
Thank
well.
you.
Thank you.